Initially, when Dad was admitted to the hospital where I work, obviously there was a lot of anxiety, a lot of apprehension. Dad's actually a really healthy 65-year-old. He walks 10,000 steps a day. He's always been on the go. He's that kind of man, really. So yeah, big shock really for such a healthy, outgoing gentleman, really. Yeah, I mean, obviously initially the first maybe up to 4 weeks he was in an induced coma anyway, so he didn't have a clue what was going on. That was probably our hardest time. You know, me, my brother, my sister just constantly calling up, and the ICU staff giving us as many updates as they could, but for a good few weeks it was just, no, there's no change, which is really sort of disheartening. The initial first few weeks, the thought of losing him as well as having already lost Mum as well was just, yeah, there was probably at least 3 or 4 times where we thought that's it now. He was that close to the edge. But just, we can't actually thank the staff here enough. There's no words, there's no present, there's nothing that can actually tell them how indebted we are to them for what they've done. And that's everyone, I think, you know, doctors, nurses, consultants, absolutely, but you know, the wider people that help them, the speech and learning, you know, speech and language team, the you know, the dietitians, the pharmacists, the cleaners, the people who fed him because he was so hungry afterwards. He just wanted to eat all the time. You know, it's just such a massive team, you know, administrators and clerks, secretaries. There's just so many, and you always think that you're going to leave someone out, but it is like right across the board of what they managed to do for him and help him be here now. And yeah, we will always be grateful to them for you know, for keeping our dad here. Yeah.
Go on, Charlie. Go on, mate. Come on.
My ward manager and matron have been absolutely amazing. They just would say, anything you need, you do it. We'll agree it. We'll support you however we can. And even being around people that just sort of understand. They've all been brilliant. All the team, the HCAs, the physios, everyone. It's constantly, oh, how's Dad, or do you need anything? And they've really, as soon as you come in, it's like, we'll ask you once, and then if you want to cry, you can. If you want to laugh, you can. So I think you kind of go on autopilot, really. I think we all have, you know. So you know that you've got to look after the children. You've got to go to work. You've got to phone up. It became a daily routine of my turn to phone, your turn to phone, and then give the kids tea, put them to bed, you know, that sort of thing. So it became part of your daily routine. But having that support around you with family and friends, but also in here, they've been amazing. Absolutely, you know, a godsend for me, really. So, which is really nice. It's a long time to not just, especially when you're a very, you know, close family and a very tactile family as well. So roll on the day when we actually are able to just sit there and give them the biggest squeeze ever, because you know, that's what we want to do. It's like, oh, this is actually happening. You're like, in, sit down, cup of tea and a piece of cake. Yeah. So he loves my mother-in-law's cake, so he's had a lot of mother-in-law's cake, which is quite nice. So yeah, no, it was, you could tell it was very overwhelming. And in the end, we said, sorry, Dad, but it's time, we're going to cry now because we can. Yeah. He's like, yeah, you carry on, mate. Oh, so, yeah, but yeah, lovely to have him in his own environment and rehab and recover that way.